Okay, this is my mail stand. I put a bunch of laps. On the top left, you see that clear container with the blue top. That's a container for the cord blood. They always get a sample of the baby's cord blood to send. You see the pickups, usually they like the Bonnie's, Rat Tooth, or the Russians, my straight suture scissors to cut. They like the curved mayo for tissue, the Metzenbaum to bring down the bladder flap, and the bandage scissors they use for cutting the cord, and it'll go with the neonatologist. So when you do counts, you have to remind the nurse that those bandage scissors are in the crib. You have the 2-ring forceps. He's going to use that to grab the uterus after the baby's out to suture back together. You got your 2 cokers. He's going to use that to get into muscle. You got your 4 Kellys. He's going to need that to get into the peritoneum, 4 hemostats for bleeders. The Alice I have there because he's going to use that to test for the epidural to make sure it's still working. You have 2 knives. You can't see it, but you have the big knife, which is the 20 blade on the 4 knife handle. He uses that for skin. Then you use the number 3 knife handle with the 10 blade for the uterus incision. You have a Richardson retractor, 2 Parkers, suction and Bovie, 2 leg covers, the bulb syringe to suction the baby's nose and mouth, and you have your towel to wrap the baby in that the neonatologist is going to take out. Your basin will have warm laps for inside the abdomen. Your bladder blade will be to retract the bladder down away from the uterus. The doctor's specific sutures, which is not going to be too many. This particular doctor only uses 5 for everything: uterus, peritoneum, fat, muscles, and skin. Dermabond, your suture box. The rest of the instruments that come with the tray, the Adsons, they will use for skin. Extra towels. That white paper is Seprafilm. They use it to prevent adhesions. They'll put it before they close the peritoneum. This little basin right here is what they're going to put the placenta in after the baby comes out. I put the extra Richardson in there because they don't use it, and I'll put the water in there to clean the instruments. All the gloves and the gowns are here. I have 4, 1 for me, 1 for the surgeon, 1 for the first assist, and 1 for the neonatologist that takes the baby after the baby's born. And you have your drape. If anything else, let me know. This is the OR. You have your Bovie, your bags, your lap counter, your board to count on, the nurse's computer. That's the monitor to check the baby's contractions and the baby's variability. You have the crib there, of course the OR bed, and that's anesthesia.